Slip disc. How is surgery done?
There are many ways to do surgery depending on where the problem is. For example, if the problem occurs in the back, in the lumbar spine, then the options of surgery can range from minimally invasive surgery to implant-based surgery. So minimally invasive surgery involves using what is known as an endoscope, which is pretty much the size of this pen, making a roughly 1 centimeter incision in the skin. And then the endoscope is passed between the muscles to the point where the disc is extruded. A bit of bone is removed to facilitate removal of the disc. The nerve root is pushed away and only the part on the disc that has protruded out is removed. The rest of the disc, which is still functioning, is left alone because they still have some function. So that is known as endoscopic spine surgery, where only a small portion, only the part of the disc that is protruded out, that is comprising the nerve, is actually removed. Now, beyond this, in some situations where this is not adequate or the patient's condition is a little bit more severe, where there is instability of the spine, then surgery may require placing implants or screws in your spine and replacing the entire disc with an artificial disc. Now, if you have slip disc in your neck, then similarly, surgery is done to essentially protect the spinal cord, to protect the nerve by removing that compression. And that involves essentially replacing this entire disc with an artificial disc. So surgery is done through the front of the neck. A small incision is made about 3 to 4 centimeters. We move between the muscles, spread the muscles aside, get to that point where the disc is problematic, and then we remove this entire disc and replace it with an artificial disc. So an artificial disc may look something like this. This is not the size of an artificial disc. This is a mock-up size. It's made of titanium, and in between you have titanium or medical-grade fiberglass, which allows movements mimicking normal movements. It is not as perfect as a normal existing disc, but this artificial disc allows movement similar to what a normal disc would do.